Good evening to all of you. I'm really sorry about this. It's about the Mac and the Windows. And Dr. Sarina is on, the president of Kerala Federation of Arts and Science, Secretary General Dr. Venugopal, President of THRISSUR and Dr. and all other dignitaries who are there, and also my congrats to all those awardees. I am actually honored to be honored. Since the time is just, we are late, I'll try just stick to the point. I shall be talking on the role of probiotic in female reproductive system. WHO in 2001 defined probiotic as the living microorganism when administered radical amount confers health benefit to the host. The female genital tract, as you all know, is a interaction among vaginal microbiota, various proteins that are there, different cells that are there. Dodelin described lactobacilli almost a century ago in 1892, and he said this is the bacilli which controls the pH of the vagina, and that is what is necessary for the health of the vagina, and till today it holds good. There are other bioactive factors of cervicovaginal mucosa, and one of the recent, I would say last 6-7 years, there are studies coming out about lactoferrin, which is an iron-binding multifunctional glycoprotein which has antibacterial, antifungal, antiviral and antiparasitic activities. The microbiota of the genitourinary system is very much derived from the gut microbiota, which is very diverse. The genitourinary are not that diverse as much as the microbiota of the gut. And whenever there is dysbiosis of the gut microbiota, what happens is you can see inactive steroids going to active estrogen, dietary polyphenols making estrogen mimics, deconjugation of estrogen metabolites, and there is generally a hyperestrogenism and the sequelae of that, like obesity, type 2 diabetes, cancer breast, endometrial carcinoma. All this can be a side effect of the dysbiosis. This dysbiosis and inflammation can lead to other disruptions also, about which in the coming slides I will be telling you. For the self-defense of the vaginal epithelium, you can see estrogen stimulates vaginal epithelium, very much dependent on the health, for the health on estrogen. It produces glycogen, which is again producing lactic acid, which maintains the pH between 3.5 and 4.5, and that is very good for our environment homeostasis of the genital system. That favors lactobacillus, and once the lactobacillus dominant microenvironment is there, everything is hunky-dory. Lactobacillus has described almost about 120 species of lactobacillus has been described. But if you look at the major groups, it is Lactobacillus reuteri, rhamnosus, acidophilus, plantarum, cassie and paracassie. Out of this, the reuteri RC14 and the rhamnosus GR1, they are the most studied ones. If you see all the probiotic that has been described, you will see most of the studies, almost about 150 publications that are there on RC14 and GR1. And these two combinations were shown to increase the level of those species in stool and in the vagina, supporting the notion of veno-vaginal transfer. There is a lot of theories that goes on, that even our washing of the perineum, whether we should do it from the back or from the front, that can change the microbiota, that can cause dysbiosis. There is a lot of theories that is going on. US Food and Drug Administration, FDA, has designated the RC14 and GR1 strains as new dietary ingredient notification. Now anyway, these strains with lactic acid products have property, and when I say these strains, I'm talking about lactobacillus, they down-regulate the toxin production, they have immunomodulatory activity, macrophage activation by lactobacillus signaling, stimulation of the secretory IgA and neutrophils, and it's really an inhibition of the release of inflammatory cytokines. Now, in India, it's not very much studied. I could find two studies. One is from Haryana by this Ojasvi Mehta. There is one from Mysore. The other two studies. And from country to country, the strain of lactobacillus that is there in the vagina and in the genital tract can vary. Maybe the diet that we take, that might be influencing. In India, you can see curd is our routine in every meal, whether north or south we take, and that is a probiotic. There are some countries where they don't take it at all. So what they found in India when they studied in the vaginal milieu, what was the common lactobacillus they found was Sinus, Crispatus, Gasseri, Jenseni and Johnsoni. But we lacked an understanding of the baseline vaginal microbiota of reproductive age of Indian women. I am seeing so many medical professors, medical college professors sitting here. I think this is what we should study, what is actually happening in the Indian women. And the genomic repertoire of the dominant vaginal microbiota associated with the Indian subject, still we require large studies. From the gut microbiome, it enters the genital tract. It can, when it enters, it can disrupt the menstrual cycle. It can disrupt the ovarian function. They say PCOS can occur, infertility can occur. Fertilization process, IVF outcome is affected. Placentation, adverse presentation, adverse pregnancy outcomes like recurrent implantation failure, recurrent abortions, these can occur. Now, as I told you, there is a high diversity of the genital intestinal tract microbiota, whereas female genital tract microbiome has a low diversity, but it changes dynamically throughout the female menstrual cycle. And this environment includes microorganisms, metabolites and immune components. Balance of the interaction of these are very important in maintaining the homeostasis of the vaginal and the uterine environment. Now, if you come to the immunology of pregnancy, for a successful pregnancy, there is a balance between invading trophoblast and the maternal deciduum. If you look at the infiltrating immune cells, you will find 70% of them are decidual leukocytes or NK cells. And when the phenotype and functions of these cells are determined by, one, the signals from the placenta, those blue that are there, and that is the invading cells, and you can see just above, you see the commensal bacteria. So factors from the normal microbiota, these are the ones which decide whether the successful pregnancy is going to occur. So microbiome is playing an important role, and in Valencia, etc., they have already started testing it, and which is the one which is, and they are coming out with test results. India is far behind on that. Once the lactobacillus comes down, when the dysbiosis occurs, Gardnerella, Prevotella, Mobilancus, Firmicutes, Mycoplasma, all this take over, and you can see on the other side all the cytokines, IL-8, IL-6, IL-1 beta, TNF alpha, all this goes up, pH goes up, dysbiosis has set in. And especially Gardnerella, it is, as you know, it forms a biofilm onto the vagina, and whatever drug you give, it is not able to penetrate there. Whatever we give, it is not able to get on to that. That is what happens with the dysbiosis. Now, whenever there is inflammation, physiological reproductive function like menstruation, ovulation, implantation, pregnancy, that is disrupted, and the other disorders, ovulatory abnormalities, PCOS, endometriosis, infertility, cancer rarely can set in. HPV, that is another inflammation where you do get cancer. Now, this is a very small study of 39 PCO patients against 40 healthy people, when they studied, they found that there is an abundance of mycoplasma and prevotella and decreased relative abundance of the crispatous. And they said that vaginal microdysbiosis may participate and contribute to PCOS pathology. Indian data is lacking. Now, we all know about TH1 and TH2 paradigm. TH1 is pro-inflammatory, TH2 is anti-inflammatory. So, whenever there is a TH2 increase, that is for a healthy pregnancy, TH2 dominance. Now, vaginal microbiome undergoes changes during pregnancy by increased stability with the predominance of lactobacillus species. Immunological, endocrinological, metabolic changes during pregnancy can cause significant alteration in microbiome. I am sure as gynecologist, as obstetrician, you will find intractable microbacterial vaginosis in pregnant women. You give anything, they just come back again and again, telling we have malodorous discharge. And it is in pregnant women it is fine, but otherwise general factors which causes this sort of a dysbiosis is when you give long-term antibiotics, when they are on immune deficient drugs, when they are on cortisone, when they are on long-term hormonal treatment, all this can cause a dysbiosis. Now, when you look at it right from below, from the vaginal dysbiosis, it can cause infertility, sexually transmitted diseases. Go up, tube affected, you can have endometriosis and ectopic. Go to the placenta, it can cause preterm labor, chorioamnionitis, recurrent miscarriage and implantation failure. Preterm birth is not just a bacterial infection, it is a multifactorial reasons for it to occur, but it is a known fact that about 40% of them occur because of some sort of an inflammation. So that has made us to say that in our protocol, in the early second trimester, just put in a speculum and see, is there an infection? If it is there, treat. Does it affect the IVF outcome? Yes, there are enough studies to see that if lactobacillus dominant microbiota are there, IVF has better outcome. Once low abundance of lactobacillus, lower implantation rate, increased number of miscarriages, decreased number of term pregnancies and decreased pregnancy rate. Several authors have studied this, but I found one review and meta-analysis by Singer et al. Who said that dysbiotic vaginal microbiota when they are present, the success rate of the woman getting pregnant is 1.4 times less compared to those who have a normal or a eubiotic configuration. Endometriosis, we all know one of the theories of endometriosis is that it has an inflammatory background, and this is maybe because of the dysbiosis that is there that they have got endometriosis. And gut dysbiosis, disruption of estrogen metabolism, endometrial dysbiosis can lead to inflammation, and the consequences are there: endometriosis, endometrial hyperplasia, obesity, metabolic syndrome. Now, pelvic inflammatory disease takes an upper hand when there is a dysbiosis, whether it is genital tuberculosis, chlamydia or Neisseria gonorrhoeae. All of them can, any abnormal genital microenvironment that facilitate the acquisition of pathogens, and the result is there: chronic pelvic pain, infertility, ectopic, tubo-ovarian abscess, peritonitis, sepsis. Other infections like urogenital infections such as vulval candidiasis. You know, it is a record that 75% of the women at one time or the other, at least once, they have had candidiasis. And globally in pregnancy, 40% of the women have got bacterial vaginosis. So, urinary tract infection. As the woman goes older, the estrogen is less. So the dysbiosis is there. The bacteria, once estrogen is less, lactobacillus is there, and the bacteria, the other pathogenic bacteria takes over, and urinary tract infections are more common. Now, what is lactoferrin? Since it's a newer molecule, I'll just say a few words about it. It is an iron-bending protein found in human secretions, and it has immunological effect, anti-carcinogenic, regenerative effects, and antimicrobial effects. Okay, one picture here, it is not coming. Anyway, it has immunological properties, stimulation of different T lymphocytes, activation of phagocytes, and what they found was that that picture, which is not coming, shows that the highest level is found in saliva and in human milk. How has lactoferrin got the antimicrobial effect? Primary role of it is to hide free iron. You might be getting some companies bringing this for treatment of anemia, lactoferrin. And so what it does is to hide free iron, thereby removing an essential substrate which is required for bacterial growth, exerting a bacteriostatic effect, and other mechanisms are bacterial lysis and inhibition of bacterial adhesions. Besides, they promote the growth of healthy bacteria such as lactobacillus and bifidobacterium. And lactoferrin also promotes the growth and diversity of intestinal microbiota, and indirectly it will help the genital also. It has an effect on oxidative stress. It's a known fact that whenever the oxidative stress is increased, that is when you have abortions or a premature rupture of membrane or recurrent miscarriages. So this is said to be moderated, and administration of lactoferrin to the vagina reduced oxidative stress of amniotic fluid in pregnant women with mid-trimester genetic amniocentesis. These data are all, you can see they are all newer data. This all has come from 2017, 21, 22. Indian data, it's not there, we have to work on it. Now, lactoferrin as well as lactobacillus together can inhibit the adhesion and consequently the microbial entry inside the cells, probably disrupts the biofilm. And it appears complementary since lactobacilli inhibit the microbial intracellular replication. This close cooperation is exerted through their anti-inflammatory action. And among the non-lactobacillus dominant patient treated with lactoferrin 3 months after the antibiotic therapy, 67% of them reached lactobacillus dominance in the endometrium. This is a recorded thing, not a very large study. In pregnancy, lactoferrin concentration have been reported to be higher in the mucus of pregnant women than in the non-pregnant women, and it is found that whenever there is an infection, let it be premature rupture of membrane, let it be bacterial, there is a increase in lactoferrin as a protective thing. It is postulated that protein participate in the host defense against intrauterine infection by controlling microbial growth and modulating the inflammatory response. This is a very small study they had done in 6 women, and they said that the pregnancy outcome was very good. I was looking for a meta-analysis, and this came in recently in 2022. This was a systemic review and meta-analysis of 300 patients where they used lactoferrin for preterm birth less than, and they found that women taking lactoferrin had a lower risk of preterm birth less than 37 weeks. But they concluded it saying large, adequately powered, randomized trial are needed in order to elucidate the actual role. So we are waiting for more studies. Probiotics, are they safe? Yes. Lactoferrin is not a probiotic, it's a prebiotic. Lactobacillus species utility is related to its status as generally regarded as safe, and US FDA has approved it as a GRAS or a generally regarded as safe. Before I conclude, I want to give a food for thought. It is just my idea. This is a treatment protocol for antibiotic-induced gut injuries. They said diet can rapidly and dramatically change the gut microbiota composition. Probiotics can alleviate antibiotic-induced gut dysbiosis. And the third part is fecal microbiome transplantation. that is FMT. It can completely improve serious antibiotic related adverse effects in the gut. So what they are doing is FMT seems to confer several advantages over that. What is happening in long-term engraftment allows it to be designated as a single dose regimen. Prebiotic and probiotic you have to keep repeating. Here with a single dose, they can, those who are having chronic diarrhea, those who are having irritable bowel syndrome. By one fecal microbiota transplantation, they are good. Now the same thing, can we use it with the vaginal? Whether a healthy woman's vaginal discharge, if we transplant it to this dysbiotic woman, will it work? It is to be studied. So to summarize, Lactobacillus pivotal components of first-line defense in the female mucous genital tract, involved in protection against a multitude of microbial infections, effective natural mechanism to dampen the inflammatory process. Lactoferrin provides antimicrobial, anti-inflammatory, immunomodulatory action, prebiotic help to restore and maintain normal gut. Prebiotics promote growth of beneficial bacteria, and components of lactobacillus and LFF beneficial effects in various gynecological and obstetrical conditions. Now, as I am saying this, it is not that I am promoting any particular pharma. This lecture was requested by Sun Pharma. Generally, if you look at the probiotic, there is one or two. One good probiotic is BSL-3, where they are using three strains of lactobacillus. So it is very good. And this particular product of Sun Pharma, they are using lactobacillus acidophilus, rhamnosus, rotary, plantarum, casei, and fermentum, and more so bifidobacterium bifidum. This is also a very good healthy bacillus. So with lactoferrin as a prebiotic, they have brought in with a very good product if you compare with ours. But unfortunately, we do not have any vaginal probiotic. There's one company which has brought out for this thing, and they have got only, it has got only 2 or 3 strains, I think. It is a lactobacillus strain. Otherwise, we do not have vaginal strain. And thank you very much for your patience.